Associate Data Engineer at Boolean Data System. Boolean Data System is select Snowflake service partner providing several customized and industry-focused solutions. Today we have Siddharth with us and I'm glad he's here to guide us through the patient readmission prediction. Hi Siddharth.
Hi Bindra.
So Siddharth, let's start simple. What is hospital readmission and why is it a critical metric for healthcare provider and payers?
So hospital readmissions refers to a patient returning to the hospital within a certain period after the discharge. So it is a critical metric because frequent readmissions indicate potential gaps in care and poor discharge planning or indicate the follow-up. So readmissions also affect the hospital's reimbursement under the programs like Medicare and may result in the financial penalties for the hospitals.
So how do readmission impact patient outcomes, hospital revenue and healthcare cost?
So unplanned readmissions negatively affect the patient's outcome by exposing the patient to additional medical risk, infections and stress. For hospitals, frequently readmissions can lead to financial penalties and reduce the reimbursement under the value-based care programs and inefficient resource utilization.
Interesting. So, what inefficiencies exist today in identifying patients at high risk of readmissions?
Currently, hospitals rely on the manual review of patient records and standardize the risk scores or institutions from the clinicians. And these methods are time-consuming and inconsistent and often fail to capture the complex interactions between the medications and social determinations and care gaps. As a result, high-risk patients may be overlooked until the readmission occurs.
Thanks for clarifying that. Now I'm curious to see this in action. Could you walk us through the patient readmission model and show us the demo?
Yeah, sure.
Great. I'm sure everyone is excited to see how it works live.
Yeah. So I hope you can see my screen.
Yes.
Yeah. So this is hospital readmission predictor, and these are some features, input features. And for this, the data are stored in the Snowflake itself, and as you can see, this is the table. This is the data which will be used for this patient readmission, and these are some of the features. And from this, some important features are already implemented in the readmission model. So let me just give you one demo. The first is number of lab procedure. So this is basically how many times a patient is gone through the lab procedures. This is the number of medications. So and this is time in hospitals. How many days the patient was in the hospital. And this is age group. So and this is medical specialty, and after that primary diagnosis, like what is the primary diagnosis of that patient, and if additional diagnoses are there, so you can just implement that. And after that secondary diagnosis. So after fill all the input placeholders, you can click the predict readmission, and it will give you the prediction as no. That means the patient will not readmit in the upcoming 30 days. So this is how it is predicting the readmission thing of any patient. So this is all about this product.
Great. Now that we have seen the demo, let's go a bit deeper. How can AI/ML model predict patient readmission risk using historical clinical data?
Yeah. So AI models can analyze the structured and unstructured patient data to identify the patterns that correlate with the readmissions. And by learning from historical admissions, lab results, and vital signs and discharge notes, AI can assign risk scores to the patient.
That's impressive. Can AI differentiate between short-term versus long-term readmission risk?
Yes. By analyzing historical patterns and trends in the patient data, AI can identify signals indicating imminent readmissions risk and versus long-term risk.
Interesting. Now, how can predictive readmission model be integrated into hospital workflow or EHR systems?
So predictive readmissions model can be integrated into EHR systems through APIs or built-in models that analyze the patient data in real time. Once a patient is discharged, the system can automatically calculate a readmission score and alert care coordinators or clinicians. These alerts can trigger the personalized interventions such as follow-up calls and scheduling the outpatient visit.
That seems really practical. And how do you ensure patient data privacy?
Yeah. So as you can see, this model is built on the Snowflake itself, and the data are also in the Snowflake itself, and the deployment as well as the production also in the Snowflake itself. So there is a high chance that there is completely 100% data security is there, because everything is done in the Snowflake itself. And ensuring data privacy requires strict adherence to HIPAA and local regulation also. So this includes the data encryptions in the transit and at rest, and role-based access control, and secure authentications and de-identifications of the data when used for the model training. Additionally, hospitals must maintain the audit trails to monitor access and modifications, ensuring the sensitive health information is handled responsibly.
Very reassuring. And in terms of time saving, how do hospitals measure the accuracy and reliability of this AI prediction in real-world settings?
So hospitals track metrics such as precision recall and area under the ROC curve to access model performance. They also monitor real-world outcomes such as reductions in the readmissions among flagged patients, and compare predicted risk levels with the actual patient outcomes, and feedback loop from the clinical help fine-tune the model and enhancing both reliability and trust.
That's a huge improvement. But how much can hospital reduce avoidable readmissions by implementing predictive models?
So studies shows that prediction readmission model, when coupled with the targeted interventions, can reduce the avoidable readmissions by 10 to 30%, and depending on the patient population and the hospital process. So by proactively identifying the high risk patient, hospitals can allocate resource more effectively and preventing the complications and improving overall care of the quality.
So, what financial impact can hospitals expect in terms of penalties avoided, reimbursements optimized, and resources saved?
So hospitals can avoid financial penalties associated with the high readmission rates, and improve the reimbursement through the quality-based payment programs, and reduce the unnecessary hospital stays. And additionally, operational efficiency gained from the targeted interventions and translate into cost saving for the staff time and resource allocations and treatment costs.
Thank you, Siddharth, for those valuable insights. We have seen how patient readmission predictor can help healthcare team move from reactive monitoring to proactive care, enabling timely interventions, improving patient outcomes, and reducing unnecessary hospital readmissions. Thanks everyone for joining us today.
Thank you, Vinta.